Can you talk a little bit about where that all started and why the foundation is so committed to this area?
Well, we started in 1972. That was when our foundation started. How many of you remember some of what was going on in 1972? Yeah, unfortunately, I can tell you, I can remember too. Remember, we thought healthcare reform was right around the corner. Mm-hmm. And then there were some political things that happened and derailed that. But that caused our foundation to say what we as a nation are saying right now. There's no way that we're going to be able to provide quality care to the people who are going to be newly insured unless we change the way our workforce is structured and the kinds of opportunities that we have within our workforce. And that caused the foundation to invest in primary care and also to invest in some of the very first nurse practitioner programs. And now, all these years later, we're saying to ourselves, we're really at that threshold now, but we know so much more than we did in 1972. So I think we really are at a point where we can know how to transform our healthcare system because we've got the people trained to do it.
Why did we go forward in 2008? Mm-hmm. I think it was about 2008 when we started all the planning, with a Future of Nursing report. What prompted that?
In a lot of ways, what prompted it was a sense of frustration that we needed to pull a lot of information together. We had been really ramping up the work that the foundation was doing with all of you and others to try to transform nursing. And we realized that you needed to have a place where people could go and see a synthesis of the problems and a blueprint for where we needed to go in one place. And that's really what the IOM does better than anyone else. We also knew that it was a time when our healthcare system was really at a crossroads. People were talking very seriously about changing the healthcare system again, and we really, that had a lot of fits and starts, right? But it was closer than we'd ever been. There was a sense that the old ways just weren't going to work anymore. People were really frustrated with the quality of care that we were getting for the amount of money that we were spending. So all of these things coming together, a change in the environment and a real sense that the nation was ready for change and that we had answers that weren't in one place caused us to say, let's put it in one place, let's create a future that people will be able to galvanize around and move towards together.